Pussies are great, pussies are caring.
Hello everyone, you are welcome to our first class in NSC 209, Physical and Health Assessment. The first topic we are going to look at today is General Survey and Physical Examination Techniques. When you hear the word General Survey outside nursing, what comes to your mind? I'm sure you just like, you see, you tell people, let's go and do survey, just go and see, let's go for sightseeing, let's just go and look at what is out there. The same thing we are going to see in nursing practice. So today we are going to discuss general survey and physical examination techniques. So stay connected, see you soon. Welcome back to the class. Like I've said in the video earlier watched, that we are going to discuss general survey and physical examination techniques part 1. We have two objectives we want to achieve in this topic we are looking at today. First of all, we are going to describe general survey, and secondly, we will describe physical examination techniques. General survey. When we are talking about general survey in nursing, what we mean is that initial survey, which is considered as a scanning procedure, and it begins as the time you have the first encounter with the client or the patient, and this will continue during the health history interview. Following the nursing history, then you make a general survey. And remember, when we are talking about nursing history, you gather information from the patient. We start from the name of the patient, the occupation, the age, and information like that the patient has to give unto you. And these are nursing history interview. And when you are conducting general survey, you make use of your eyes. So you see everything the patient is doing from the time the patient enter into your clinic up to the time you are asking him what is his name or her name, up to the time you are asking him how the complaint that this individual is having, how is he or she able to describe that complaint without mixing words, without being disoriented to time and space. All this we are going to observe. You also observe the neatness of that patient, and all these things is going to make up your report at the end of your survey. This is a typical example of a general survey conducted on a woman called Mrs. A. This Mrs. A is a 45-year-old Yoruba woman with the following vital signs: blood pressure, pulse, and respiration. No distinguishing body features. That is, in another word, when you assess the individual as a nurse, there is nothing wrong with the physique of this individual. Although you see that she is conscious but anxious. The speech, in another word, when you were talking with her, you also observe that the speech was rapid with trailing thoughts, and this individual was wriggling hands and shuffling feet during interview. And you also observe that the skin is flushed, hand clammy, and also without you touching yet, you can see that, overweight relative to height. And when you are interviewing the individual, this woman, the eyes were downcast and the shoulders slumped, and she was avoiding eye contact. So all these things is what you can observe. Mind you, the woman might not even know you were looking at her. You are taking this observation, and That is why observation is a key tool in nursing practice. As a nurse, you must be able to observe without even speaking word. And your observation, like I said earlier, has to start from the first time that woman, that man, that child was entering or is entering, who is entering into your clinic. And at that point, you are making your general survey. You are taking every bit of what you are observing. So that is all about general survey. We'll move to the second objective, which is description of physical examination techniques. We have 4 physical examination techniques that we are going to look at. The first one is inspection, second palpation, third percussion, and the last one is auscultation. Now, all these follow sequence when you are doing general physical examination, except when you are doing abdominal examination. And why this sequence is not followed when performing abdominal examination is because when you palpate or percuss before auscultation, it will alter the abdominal or the bowel sound, and it will make the result that you get at the end of the day to be a false finding. So in most cases, when you are examining the abdominal region, you first of all do your auscultation before you do your palpation and percussion. In another word, you first of all do inspection. When you are doing abdominal examination, you do inspection, you follow it by auscultation. Inspection, we'll look at it in detail later on. You first of all do your inspection, followed by auscultation, then palpation and percussion. The first examination techniques we are going to look at is inspection. What do we mean by inspection? Inspection is the visualization of a body part or region in a systematic way and a focused manner that will tell you whether that part is normal or there is any deviation from normal. Like this nurse is assessing the face region, the facial region of this client, and you can see that he is focused on that face alone and probably asking the client a question. So while you are doing your assessment, what are the things can you observe at this stage? The nurse can observe the skin color, if there is rashes anywhere. Let's take an example of inspection of abdominal region. Okay, depend on the sex and depend on the age of that individual. Let's look at a woman that is pregnant and you want to inspect the abdominal cavity. So what you have to do after taking permission from that individual, and you explain what exactly you want to do with what you want, you explain exactly what you want to do to the client, and the next thing you ask the client to do is to lie on her back, and when the client lie, you expose the abdominal region and you do your assessment. Remember, we say that it's focused and it's systematic. So systematic in the sense that because it's abdominal region, you start from the upper part. You start from the upper part before the lower abdominal region, and you have to be focused. What are you looking at? Like I said, for pregnant women, for instance, it depends on the age of pregnancy and it depends on the number of pregnancy that individual has carrying. You have to assess if there is any mark on the abdomen. If there is mark, you have to ask the individual where does the mark come from, whether it's from appendectomy or from previous cesarean section. Remember, if this individual say, oh, I'm just carrying my first child, and you are now seeing a mark that the individual will just tell you that, oh, it's a cesarean section, it's a point that will take you to make a further further inquiry to know what happened within that period. Probably the client forgot to tell you why when she was giving you
the nursing history or during the interview, and by so doing it will make you to render a better care for this individual. And that is why inspection is a key tool that you use when you are doing physical examination, as it can lead you to make further inquiry and to make you to give a better care to your client. The second technique we are looking at is palpation. What do we mean by palpation? Palpation is done by use of hand to assess the body part or a region of the body, to assess for any abnormality or normality, that is, if the part is normal or not. And we have different parts of the hands that you use. You can use the back of the hand, which is known as the dorsal surface, or the front of the hand, which is known as the palmar surface. You can also use the finger tip to palpate, or the pad of the finger. It depends on what you want to palpate. You know, in nursing profession, like we said, all these physical examination techniques are very important. So for palpation, you make use of every part of your hand. Like if you want to detect temperature without using your thermometer, remember thermometer will give you the exact degree of the body temperature, while this one will only make you to know, oh, this person is having temperature, before you start looking for your thermometer or not. So when you want to assess individual for temperature, you use the dorsal surface, which is the back of the hand, and not the palmar surface of the hand. We have different types of palpation. We have the light palpation and the deep palpation, depending on exact thing that you want to do. For light palpation, you can use the pad of the finger when you are taking the pulse of a patient. And like this nurse is taking the pulse at the radial artery, because we have many parts of the body you can take pulse. But however, when you are taking pulse, you make use of the pad of the finger to take your pulse. And also, this nurse is palpating the vertebral column. You may also make use of the pad of the hand. Also, depending on what you want to, if it's the symmetry you want to look at, you can just place all your hand, all the palmar surface like this nose, across the structure or across the body surface you want to assess. Then you talk about deep palpation. For deep palpation, you conduct it on organs that are deep rooted within the body cavity, like the liver and the spleen or the kidney. What do you want to observe? What do you want to achieve when you are doing deep palpation? You know, like I said, that this is the method you use when you want to assess deep organ that are deep rooted within the body cavity. You want to assess for tenderness. For instance, the patient complain of pain. When the patient is having that pain, when you apply, depending on severity of the pain, you can apply light pressure. That is, you can apply light palpation, and the patient, you are able to get what you want. But in some cases, you have to apply deep palpation for this tenderness to be assessed. And also, if there is enlargement, you also apply deep palpation you also conduct deep palpation to be able to ascertain the mass within the body cavity. The third technique we want to look at now is percussion. What do we mean by percussion? It's the act of striking the body surface to elicit sounds that can be heard or vibration that can be felt. And the type of sound you heard or vibration you felt determine the functionality of that structure that you are trying to assess or examine. And normally every organ or every structure in the body has certain sound or vibration that is termed to be normal, while some are termed to be abnormal. Let's look at the types of percussion. We have the direct percussion. There are actually three types. We are going to look at them one after the other. We look at the direct percussion. How do the nurse perform direct percussion? When you want to perform direct percussion, you strike the area to be percussed directly with the pad. I'm sure you still remember the previous slide that showed the different parts of the hand. So you now you use the pad of the hand to percuss the place, and you use it to tap the place that you want to access, and you'll be able to determine if the sound you are hearing from that side is okay or not. Actually, it depends on the area you want to do, what you want to access, the area you want to access, and exactly what you want to achieve. Determine the type of percussion you conduct. The second type of percussion I want to look at is the indirect percussion. The indirect percussion is most commonly used in nursing practice, and this will produce a clear, crisp sound when performed correctly. How do you perform the indirect percussion? The nurse place the non-dominant hand. The non-dominant hand is the hand that you are not using to perform task. That is the non-dominant hands. While the dominant hand is the hand that you use to perform most of the task. For instance, we have the left-handed people. That shows that the left become the dominant hand. While majority that are right-handed people, the right hand become the dominant hand. While the vice versa actually. So for this, use the non-dominant hand to place on the area that she wants to access, and you look at the middle finger which she placed there. That is the middle finger that is going to use to elicit the sound from the structure he is trying to examine. And now you use the dominant hand, the middle finger of the dominant hand, to strike the area, the middle finger that he placed on the structure that he wants to access, and release a kind of strike. He make a strike on the site, and we assess the sound that elicited from that sound. The third type of percussion we are looking at is the blunt percussion. This is performed by making a fist. That is, the nurse make a fist and use the inner side of the fisted hand to strike the location that he or she want to access. And when he strike the site, there should be a sound that generates from the strike, and that sound is what he is going to use to evaluate whether the sound is normal or there is deviation from normal. And this will take us to the types of sound or vibration that you can hear, that you can hear when you are doing percussion. We have different types of percussion sound depending on the structure. When you talk about the flatness, that is, the sound is flat. This flat sound that you can elicit can generate from a bone or muscle, and for a flat sound over the bone or muscle is the right normal sound. But when the sound is not flat, maybe it's dull or resonant, you now know there is problem over the bone of that area or the muscle of that area. The second sound is the dullness, is described as dullness, which is a dull sound. It's a thud-like sound, and these are the sound that you can hear when you perform percussion over the heart, liver, or spleen. It is a normal sound over these organs. However, if you perform a percussion over the heart, the liver, and the spleen, and you have any sound contrary to this dull sound, you know that yes, that is deviation from normal. This third sound is the resonant sound. The resonant sound can be heard over the lung. That is the normal lung. Normally our lungs are filled with air, and when you percuss the lung, you'll be able to hear a sound that is being described as resonant sound. It's a hollow sound, loud in its intensity and low pitch, and it lasts for a long duration. Remember, at the beginning of this course, we make mention of your knowledge of anatomy and physiology that will actually help you. So you can I hope that you remember where the location of the lungs are in the body, and you know that when you strike that particular aspect of the body, which is within the chest cavity or at the upper part or the lower part of the back, depending on the section of the lung you want to actually assess. So you'll be able to hear this resonant sound, which is normal sound. Anything that is different from this resonant sound, if it's dull or flat, you know there's something wrong with the lungs. Then the fourth type of sound or percussion sound is hyper resonant, and this hyper resonant is a very loud intensity and it lasts long in duration. You can only hear this kind of sound over the lung when the lung is filled with pus, which is supposed not to be, and that is the condition known as emphysema or emphysematous lung. So when you are hearing hyper resonant sound over the lung, you know that there is a problem in that lung. Then the last type of sound is tympanic sound. It's just a drum like, and this is the sound that you hear when you percuss the stomach, because the stomach still has a little of air in between the stomach. So you hear tympanic sound when you percuss your stomach. Try and practicalize all this within your body, and it can make you to know when there is abnormality when you are performing it on your patient. The last type of physical examination we are looking at is auscultation. Auscultation is the listening to sound produced by the body to assess normal condition and deviation from normal. And auscultation is usually performed with a stethoscope. A stethoscope has different parts. We have the earpiece, bell, diaphragm, and the tube. And all these parts, especially the bell and the diaphragm, have their own function. There are situations where you use the bell, and there are some situations where you use the diaphragm. It depends on exactly what you want to assess. Remember, at the beginning of this class, we mentioned that this physical examination technique, the 4 physical examination techniques, follow a sequence in some assessment of certain parts of the body. However, let's look at the lung. We said that from percussion that you percuss the lung. When you percuss the lung and you discover any abnormal sound, instead of the normal sound which is resonant, if it's hyper resonant, you will now move on to auscultation. And in performing auscultation, you use your stethoscope. I hope you still remember from the previous slide where we call the diaphragm and the earpiece. So you put the earpiece inside the ears, and you now play the diaphragm. This is the trachea. Like I said in the previous slide also, that the lung extends to the back, and from the chest cavity, when you look at this number, correspond to the lungs, the 2 lungs. We have the right side and the left side, and this is the front view and this is the back view. So you place your diaphragm over the upper right lung field, and this is the upper one, this is the middle, and this is the lower one. So you place the diaphragm on each of these points, and you ask the patient to breathe in and breathe out, and you listen to the sound. Definitely when it's abnormal, it's different from the normal sound. After you finish with the anterior aspect, you move on to the back, and you also perform the same thing. And this brings us to the end of our class today. So we were able to discuss general survey, physical examination, and remember that not every assessment area requires the use of all these 4 techniques we have discussed today. Just for example, the musculoskeletal system required only inspection and palpation. However, when you are examining the musculoskeletal system, remember that it's only inspection and palpation you can perform. Thank you. Thank you very much. See you next for general survey and physical examination technique part 2.